My name is Robert Rothrock, and I am a spinal neurosurgeon and director of Spinal Oncology at Miami Neuroscience Institute. Born and raised in Miami, Florida, I was actually born at Baptist Hospital, so I consider myself a child of the community, and it's my great pleasure to return and to be able to provide for the community that I grew up in. I have a specialized interest in all conditions of the spine, primarily degenerative, deformity, but especially tumor. And that means anything from metastatic cancer that spreads to the spine to primary spine tumors and tumors within the spinal cord and the lining of the spinal cord. The most common problems that we treat in the world of spine surgery are radiating pain from the neck or the back into one of the extremities. We call that radiculopathy. Also, metastatic cancer to the spine. The spine is the third most common site for metastatic tumors. And so it's unfortunately very common for patients with cancer or who live long enough with cancer to develop metastases to the spine. We have the ability to treat everything from the common back pain to the world's rarest tumors and spinal conditions. The most common procedures that we perform for degenerative problems in the spine include anterior cervical fusions, as well as posterior cervical fusions. Those are often geared towards not only pain, but also spinal cord compression, and they can be much more serious in their nature. Because of that, they're not always elective. We also perform procedures regularly on the thoracic spine and compression of the thoracic spinal cord, and of the lumbar spine, most commonly with decompressions alone of nerve roots, especially for pain only radiating into the legs. And for patients with back pain and leg pain, often the correct treatment involves spinal fusion. There's no better example of multidisciplinary care in medicine than a spine center like ours. We have our physiatrists and pain specialists literally across the hallway from our spine surgeons, which allows our patients to come to one location to receive all their care. That's a game changer in South Florida. I personally don't believe in criteria for referring providers, and that's a controversial subject, but I never want a barrier to someone sending me a patient. When it comes to patients with degenerative spine conditions, the first thing I'll always ask a spine patient is, can you live with it? And that really sets the tone for the conversation. For the patient who's not ready for surgery yet, we'll come up with other conservative measures to treat them. For the patient who's been suffering for years and is ready to take a step and make a change, we're gonna take them through that. We're going to explain everything from the diagnosis to the imaging and finally to the treatment. For too long, there's been too much of a wall up for patients to have access to spine surgeons. And while I can't speak for every institution, I would say that here we are willing and able to see any patient with any spine complaint, whether they're ready for surgery or they're early on in their course of care.